Disorder. Jack stared blankly out the window of his tiny apartment. The city streets below bustled with life and activity, but he felt utterly disconnected from it all. A heaviness weighed on his chest, making it hard to breathe. He knew the feeling all too well, the gripping claws of depression digging their way into his mind once again. Ever since he was a teenager, Jack had battled this debilitating illness. Some days were better than others, but the bad days were utter agony. His thoughts would spiral into darkness, convincing him that his life was worthless, that he would never amount to anything. Anxiety would set in, his heart racing with panicked thoughts about the future. Intrusive, disturbing thoughts would take over, looping through his mind on repeat no matter how hard he tried to push them away. Jack had been diagnosed with major depressive disorder, generalized anxiety disorder, and OCD, a triple threat of mental illnesses that made every day an uphill battle. He had tried countless medications and therapy techniques over the years, but nothing could completely free him from the torment. Across town, Emily was facing her own inner demons. Though outwardly she appeared a cheerful young woman, her mind was plagued by terrifying visions and paranoid delusions. Emily had schizophrenia, a cruel mental disorder that caused her to constantly question reality. She would hear menacing voices whispering vile things, or see shadowy figures lurking in the corner of her eye. At her worst moments, Emily became utterly convinced that someone or something evil was after her. She would cower in fear, unable to trust her own senses as the hallucinations took over. Adding to her anguish were the traumatic memories that constantly resurfaced. As a child, Emily had witnessed an act of horrific violence that scarred her for life. She relived the terror every night in her dreams and flashbacks. The PTSD made her feel like she was trapped in a constant state of fight or flight, her body's stress response stuck on high alert. Despite their crippling mental struggles, Jack and Emily found solace in each other's company. They had met by chance at a local support group and felt an instant connection over their shared pain. Dating certainly wasn't easy with the challenges they faced, but they cherished the unconditional understanding and acceptance they provided one another. Jack admired Emily's warmth and resilience in the face of such darkness. Emily was amazed by Jack's profound kindness and empathy, despite the heaviness he carried within. When they were together, they could let their guards down and simply be themselves, no longer having to hide their struggles. For a while, their love helped alleviate the worst of their symptoms. Jack felt a sense of purpose and hope when he was with Emily. Her presence acted as an anchor, keeping him tethered to reality when his mind tried to drift into the abyss. Emily's paranoid voices grew quieter, and she could more easily distinguish what was real from what were tricks of her mind. But as the months wore on, the illnesses began wearing them down again. Jack's depressive episodes became longer and more severe, to the point where he could barely get out of bed. The negative thoughts grew louder and more insistent, whispering that even Emily's love wasn't enough of a reason to keep going. Emily's schizophrenia caused frightening breaks from reality that made it difficult to function. She would lash out at Jack in anger and fear, unable to trust that he wasn't a threat like the hallucinations tried to convince her. Her PTSD symptoms flared as well, making her relive the traumatic childhood event over and over like a waking nightmare. They fought constantly, both miserable and unable to communicate their pain in a healthy way. Jack became emotionally detached and unable to engage, shutting Emily out. Emily believed Jack's distance meant he was becoming unfaithful or plotting against her. The vicious cycle spun on and on. One day, after a particularly bad argument, Jack locked himself in the bathroom and stared at the bottle of sleeping pills. He had hit a new rock bottom, feeling like more of a burden to Emily than a partner. The dark thoughts crept in, convincing him that he would be doing them both a favor by ending his life right then and there. Terrified by where his mind was taking him, Jack forced himself to call a crisis hotline. The counselor on the other end could hear the anguish and desperation in his voice. They gently but firmly told Jack that he needed to admit himself to an inpatient psychiatric facility before he hurt himself. Reluctantly, but knowing they were right, Jack agreed. When Emily returned home later to find the apartment empty and a note from Jack about where he was, she collapsed to the floor in tears. Had her worst delusions finally come true? Was Jack abandoning her, or being held hostage somewhere? It took all of the crisis counselor's skills to explain the situation to Emily and convince her that Jack had taken this step towards healing voluntarily. Hearing how close he had come to taking his own life finally made the urgency of the situation clear. Emily agreed to check herself into the same facility for her own treatment. The locked psychiatric unit felt like stepping into a different world. Jack and Emily were terrified at first, surrounded by other patients in the depths of their illnesses exhibiting bizarre and unsettling behaviors. It was a harsh glimpse into the potential worst-case outcomes of where their mental struggles could lead if left unchecked. Under the watchful eyes of nurses and counselors, Jack and Emily were kept strictly apart during the first few weeks. This allowed them to finally focus completely on their own recovery, without the complicated dynamic of their relationship getting in the way. For Jack, the early days were grueling as he endured therapy sessions digging into the root causes of his depression, anxiety, and obsessive thoughts. The therapist tried different treatment approaches like CBT and EMDR to interrupt and rewire his destructive thought patterns. He was placed on a regimen of psychiatric medications, some new types he hadn't tried before. The side effects were difficult to deal with at first, leaving him nauseous, disoriented, and sometimes even more anxious or depressed before the drugs had a chance to properly take effect. Meanwhile, Emily underwent her own intensive daily therapies targeting her schizophrenia, PTSD, and related symptoms. She slowly opened up about the traumatic childhood event that had shaped her life in so many ways, a brutal act of violence her and her sister had witnessed in their own home as little girls. Over and over, Emily had to relive and process those memories in a safe, controlled environment with professional guidance. It dredged up almost unbearable fear, sadness, and anger all over again. Yet facing the root trauma head-on was the only way to begin breaking the cycle of flashbacks and paranoia. The antipsychotic medications Emily was prescribed produced difficult side effects as well. She dealt with disturbing restlessness, muscle stiffness, and tremors that made her feel like a zombie at times. The doctors repeatedly adjusted dosages and combinations of drugs, trying to find the best balance of controlling her psychosis while limiting adverse effects. After a couple months of no contact, Jack and Emily were finally allowed supervised time together on the facility grounds. They barely recognized the shells of their former selves, Jack looking gaunt and exhausted with dark circles under his dead eyes, Emily jumpy and frail after losing so much weight. Yet they clung to each other fiercely, sobbing at the shock and relief of reuniting after being stretched to their breaking points. They promised to be there for one another, to fight through the darkness side by side no matter how hard it became. Their love was a fragile flame, but it had reignited. With new strength, resolve, and stamina from the professional care they were receiving, Jack and Emily attacked their healing process with determination. There were still many setbacks along the way as new medications were adjusted or therapies were tweaked to find the right fits. They each had to be briefly readmitted to individual rooms a few times after serious episodes, Jack following a suicide attempt, Emily after a terrifying delusional break. But the staff stayed firm and compassionate, keeping them on track without judgment or giving up hope. Slowly, agonizingly, their conditions began improving in a way they had never experienced before despite years of trying. Jack's suicidal thoughts lifted like a heavy fog, his mind becoming clearer than it had been in decades. Emily gained a better ability to recognize delusions from reality without as much fear. Group therapy sessions were a reminder that they weren't alone. Jack and Emily formed bonds with other patients bravely facing their own mental health journeys. Sharing their stories brought solace during the hard times and space for celebrating small victories. After 8 grueling months of intensive inpatient treatment, the day finally came for Jack and Emily to graduate to outpatient care. Though the future still felt uncertain, they were being discharged with an extensive set of tools and ongoing support systems in place to help them integrate back into their lives. For the first time in years, there was a lightness to their steps that had been beaten down by the weight of their illnesses for too long. Hand in hand, they walked out of the treatment facility, survivors emerging from the darkness with new hope and purpose. They spent several more months in transitional housing near the outpatient clinic, allowing for a gradual adjustment back into independence. Every day brought new lessons in applying the skills they had learned, mindfulness practices, coping mechanisms for dealing with stress and negative thought spirals, lifestyle routines to maintain stability. There were setbacks and slips, old bad habits that would creep back in before Jack and Emily caught themselves. But they had finally broken the cycles of despair, using the techniques that worked for them to get through the hard days. Throughout it all, their love persevered, slowly healing and strengthening like a wound finally being allowed to properly mend. Their commitment to caring for themselves and each other became resolute. On a bright spring day when the flowers were in bloom, Jack decided it was time. He had been working up the courage, determined to put the final pieces of his new life into place. After securing new jobs for them both and finding the perfect little apartment, he got down on one knee and proposed. Emily wept tears of pure joy as she said yes, grateful to have found the clarity of mind to appreciate such a meaningful moment without fear or paranoia getting in the way. This time, the delusions wouldn't steal her happiness. Their wedding day was simple but beautiful, a celebration with the resilient group of friends and families who had stuck by them during the darkness. Jack and Emily exchanged heartfelt vows, promising to keep fighting for their health and supporting each other without judgment. No longer did they have to hide their struggles with mental illness, but wore them with pride as battle scars from the journey that made their bond unbreakable. They vowed through tears to face whatever challenges still lay ahead together, forever grateful for the selfless professionals who refused to give up on them. As Jack swept Emily into his arms to share their first dance as husband and wife, he felt a renewed sense of freedom and hope for the future. The demons still lingered, and always would to some degree, but they no longer had power over his life. Emily gazed up at her new husband, at last allowing herself to feel fully present and alive in the moment without fear diluting the joy. She clung to Jack and knew that no matter what, they would be okay. Their life together as a team battling their illnesses was just beginning. There would still be difficult days and setbacks, cycles to persevere through. New crises and dark moments might arise that would test the limits of their strength. But Jack and Emily now had the skills, perspective, and support system to handle whatever came their way. Their love had triumphed, carrying them through the deepest depths of despair to finally reach the other side. And no matter how many times the darkness encroached on the light, they vowed to keep choosing hope and fighting to protect their hard-won healing together. The end.